Lauren, can you just give us a sense, an update of how the vaccination process has been deployed so far?
Yeah, I think spotty is a good word for how it's been deployed so far. So we're tracking both how many vaccines are going out to states, but also how many vaccines are going into people's arms. And I think given the supply chain challenges and the distribution challenges and the fact that each state is sort of determining the process on their own, we are seeing different levels of success across the country and across the globe. And I think one of the keys is going to be, as we get more vaccine online and into the hands of vaccinators, continuing to send that message that this is safe, this is effective, you want it, you should get it, and that we can do this successfully. That'll be key.
When you talk about the different levels of success and the supply chain disruptions, I'm wondering if you think we're still on track to have the normal public start to get vaccinated in the United States, starting perhaps as early as March, April.
Yeah, I think somewhere in late Q1, early Q2, we'll start to see the public get vaccinated routinely. I think the focus really on the supply chain is going to be ramping up not just production, but all those pieces that you need to get the vaccine safely into the hands of people who can give it to people, right? So the dry ice, the freezers, all the cold chain storage issues, the glass vials, even things like gloves and masks, we're going to need to keep an eye on to make sure that all those steps can be done safely. So, making it safely, moving it safely, and then distributing it and giving it safely.
What's this going to look like? Are people going to call up their doctor's offices and go there? Will it be at CVS's and Rite Aids? How will it be deployed?
I think we're sort of all waiting to see how it will be deployed. I think we're going to learn a lot based on how it's deployed in the healthcare setting and in long-term care facilities, which is basically what's happening right now. I imagine that at some point, yes, we will see this start to look like the way the vaccine is given for a flu shot. It might model some of the testing strategies, right? So you drive up, you set your appointment, you drive up and you get your vaccine. A lot of it is going to be focused around education and need. So making sure that you can safely, while we still have all this community transmission happening, that you can safely get people in and out without exposing them to the coronavirus. That'll be really important too.
Lauren, it's December 23rd. I just checked. We've been dealing with this for almost a year. Are you surprised that we don't have a better plan for exactly how people are going to get it, a bigger national plan in each country to try to get the rollout more even?
Yes and no. I think the vaccine came online incredibly quickly. Even, the scientists who are working on it, I think to an extent are surprised by that. I think some of us are surprised by the lack of staff, how impactful the lack of staff has been. We've known we've had a healthcare provider shortage in the U.S. for a long time. It's gotten worse, and I think we overestimated our volunteer workforce to an extent, and that is impacting our strategies for vaccine rollout. I think everyone is surprised by the lack of national strategy broadly across this pandemic response. So not just vaccine allocation, but testing, PPE shortages, sharing of resources across the country as the outbreak moves to different parts. All of that, I think a lot of us in preparedness and response were really hoping that our planning and our preparedness activities would lead to a more systematic strategy across the U.S. rather than the piecemeal or patchwork strategies that we're seeing implemented at the states levels. And state and local planning is incredibly important, and that's where all of the activity begins. But a national strategy for something like this is absolutely critical, and that's where the surprise lays, is not really having that.